Is your baby sneezing, coughing, and struggling to sleep at night? Don't panic. I'm here to support you throughout this harmattan season. Usually, newborn little ones struggles or face issues during the harmattan season, but with small pushes and changes, your baby will be strong and healthy again. Hi, welcome to Fed Mama. I'm Nurse Falmata, a registered pediatric nurse and a mom. I'm here to support you on this harmattan season because many little babies struggle with cough and colds during this harmattan season, and it's a very common issue, and many first-time moms struggle with this. So I'm here to teach you what to do, when to do it, and when to go to the hospital. Stay tuned. But before we dive into the video, make sure you subscribe to my YouTube channel, like this video, and share it with your friends. If you have any questions, please drop it in the comment section. Cough and colds during harmattan season is usually caused by viruses, and it spreads rapidly during harmattan because of the dust and the wind season, and it's a cold period, and the babies are very small, not yet immunity is not yet fully developed, so they can catch cold easily. So as a first time mom, here's what you need to do to if your baby has cold. The first thing that you need to do, don't panic. Be calm, because if you panic, then you will not be able to understand what's the really, because is it a cold, cough, or other respiratory issues. So if you are calm, you can able to help this baby and support the baby and understand it will help you to know what you need to do at the right time. And if you notice your baby has like stuffy nose, coughing frequently, facing difficulty in sleep, or your baby is very weak, then there might be very high tendency that your baby has colds. And here's the sign and symptoms of cold and cough. The first thing is coughing. It usually frequent during the night, usually occur at night. If your baby keeps coughing, then your baby may have a cold. The second thing is that your baby have runny or stuffy nose. If your baby has this, then there is a high tendency that your baby has cold. If your baby has mild fever, your baby is breathing fast, or your baby is have uh, unable to suck properly, or having challenges, your baby is very weak or something like that. If you notice any of the above mentioned symptoms, then your baby might have catch cold. So you don't need to panic. Here's what you need to do as a first time mom. The first thing that you need to do is monitor that baby's temperature. If you have thermometer, you can use it to monitor the baby's temperature. If you want us to make a video about how to measure your baby's body temperature, please indicate in the comment section. But after you measure your baby's body temperature, it will give you a clue on how to dress that baby. If the temperature is above, reduce the dressing, don't overdress the baby. But if the temperature is stable or normal, then dress the baby according to the weather or according to the baby's temperature. But if the baby's temperature is below normal, then dress the baby properly by putting on the caps, the socks, the mittens, and cover the baby with blanket or something like that. The next thing that you need to do is, if your baby's nose is stuffy, please is still or drop saline water inside your baby's nose. There is make saline drop, and and you can make it easy. If you want us to make a video about how to mix a saline water to still in your baby nose, please indicate in the comment section. So if you instill the saline water, it will loosen the mucus in your baby's nose, and this will also help your baby to breathe normal and to breathe easily, and your baby may be relieved from that stress. The next thing that you need to do as a first time mom is feed your baby more frequently. Yes, this is work life emergency. If you notice, it's not just for cause for any kind of business. Please, if your baby can suck, please breastfeed that baby frequently because it helps a lot, especially in this cold. If your baby catches cold, the baby's body undergoes metabolic activities that need extra calories, extra hydration, and everything. So if you keep breastfeeding your baby frequently, your baby will have the enough calories to fight that infection, and your baby's body system has enough water so that your baby will not be dehydrated. And if you continue to breastfeed your baby 2 hourly, your baby gets more antibodies to fight this infection. So it's very, very vital, and don't joke with it. The next thing that you need to do as a first time mom is if your baby if your baby is struggling with breathing or fast breathing, it's still you elevate the baby slightly, not more to the baby fluid or something like that. Allow your baby to breathe freely without it. Here I want to see a doctor. After you perform all this and your baby continues with this or have one of the following days, rush this baby to the hospital, rush your baby to the hospital. The next thing you rush to the hospital, I said rush to the hospital because the first thing that if you notice your baby has body temperature that is above 8.5, on this that baby are rush your baby to the hospital. The second thing that you need to observe is your baby breathing fast. There's sometimes in medium baby but as a mother, you are always baby, and you know that breathing is abnormal. And if you feel that that situation is not normal, or your baby has losing breathing or failing to breathe, then those that this baby to the hospital. Then it may need extra care. Then the next thing that you need to observe if your baby is not taking it, so your baby is not taking it, don't waste that. Don't waste that baby. Because your baby hypoglycemia and it's correct the condition. So wait the baby to the hospital. This is why that baby to the hospital. The next thing that you need to observe is if your baby is very weak, if your baby is very weak, for extra you go to the hospital, if don't and or corrupt or confuse injected something like that. When they ask you about your baby's condition, that you don't that you give proper today or something like that. And if this baby has you dress the baby and you need to like if there is any tight clothing or something like that, make sure you remove it or lose it so that the baby can breathe normally or something like that. And if you find this video helpful, please don't forget to thumbs up this video, share it with your friends, and subscribe to Fit Mama for more weekly tips.